ACOG officially adopts a, quote, informed consent model and officially rejects the need for psychiatric evaluation as a necessary prerequisite for clinicians to provide self-identifying transgender patients with access to cosmetic drugs and surgeries. Therefore, according to ACOG, it is appropriate for patients to self-appoint their own extreme treatment plan with virtually no expert oversight, nor risk-benefit analysis performed by any clinician. Excerpt from ACOG Bulletin, again, this is your words if you're listening. Quote, historically, a referral letter from a mental health professional was required before initiating a patient's gender-affirming hormone therapy. However, current consensus is that an informed consent process without a separate letter from a mental health care professional is more than adequate for initiating therapy from those patients who wish to medically transition. Mothers, females' position on, quote, informed consent model of care for trans-identifying patients. We oppose strongly the idea that mentally ill patients can give informed consent for transgender medicalization, which can have profound and often irreversible lifelong impacts on the health and well-being of the patient. Gender dysphoria is listed in the DSM as a mental illness. Therefore, patients with gender dysphoria are by definition incapacitated to give consent. Number 3, ACOG asserts that OBGYNs have a responsibility to assist patients with accessing gender-affirming medical care, which transgender medicalization, which includes but is not limited to cosmetic double mastectomy for women, known as top surgery, cosmetic use of opposite-sex hormones, androgen testosterone for females, estrogens for males, cosmetic hormone blockers, quote, puberty blockers for prepubescent children, including the off-label use of a prostate cancer drug called Lupron, for which use has been outlawed in many countries, excluding the U.S. Cosmetic vaginectomy, which is the surgical removal and closure of the vagina, irreversible, of course. Cosmetic bilateral sapingo-oophorectomy, which is the surgical removal of the healthy ovaries, thereby throwing the patient into immediate iatrogenic menopause. We're putting 17-year-olds in menopause. I'm in menopause because of cancer treatment that I underwent in 2021. I was 33 years old at the time. My risk of dementia is now tenfold increased. The chances of me getting it early are extremely high. How dare you? How dare you do this to little girls, young women, mentally ill women? Shame on you. Excerpt from ACOG Bulletin. Again, these are your words. Hysterectomy with or without bilateral sapingo-oophorectomy is medically necessary for patients with gender dysphoria who desire this procedure. And again, you already told us that we don't need psychiatric oversight. So anybody who just walks in, is maybe manic or psychotic, and says, hey, I want to get my hysterectomy taken out. You know, maybe because, I don't know, I was raped from the time that I was 5 to 11. And I want to escape the body that the abuse occurred in. And your doctors are like, sure, let's go.